Fatty liver disease has become increasingly common in many parts of the world, affecting about 25% of people everywhere. It is linked to obesity, type 2 diabetes, and other disorders characterized by insulin resistance. If fatty liver isn't addressed, it may develop to more significant liver disease and other health issues. What is a liver's function? Your liver is an essential organ with multiple life-supporting functions. The liver produces bile, which helps with digestion, makes proteins for the body, stores iron, converts nutrients into energy, creates substances that help your blood to clot. This makes it stick together to heal wounds. It helps you resist infections by making immune factors and by removing bacteria and toxins, substances that can harm your body, from your blood. What is a fatty liver? Fatty liver disease is a common condition caused by the storage of extra fat in the liver. Most people have no symptoms and it doesn't cause serious problems for them. In some cases, though, it can lead to liver damage. Fatty liver happens when too much fat develops in the liver cells. Although it is normal to have a tiny amount of fat in these cells, the liver is considered fatty if more than 5% of it is fat. Your liver is the second largest organ in your body. It helps process nutrients from food and drinks and filters harmful substances from your blood. The good news is that you can often prevent or even reverse fatty liver disease with lifestyle changes. There are lots of medical terms relating to fatty liver disease and it can get confusing. The main medical umbrella term, NAFLD, refers to a fatty liver that is not related to alcohol use. NAFLD is further divided into two groups. Non-alcoholic fatty liver, NAFL, otherwise known as simple fatty liver, or non-alcoholic steatohepatitis, or NASH. Symptoms. There are various signals and symptoms of a fatty liver, however not all of these may be present. In fact, you may not even be aware that you have a fatty liver. Fatigue and weakness, slight pain or fullness in the right or center abdominal area, elevated insulin levels, and larger than normal breasts in men. If fatty liver progresses to NASH, the following symptoms may develop: loss of appetite, yellowing of eyes and skin, nausea and vomiting, and moderate to severe abdominal pain. It is crucial to see a doctor routinely for standard exams and blood tests that can diagnose fatty liver at the early reversible stage. What causes fatty liver? There are a few factors that may trigger or contribute to developing fatty liver. Obesity. Obesity involves low-grade inflammation that may promote liver fat storage. It's estimated that 30 to 90% of obese adults have NAFLD, and it's increasing in children due to the childhood obesity epidemic. Excess belly fat. Normal weight people may develop fatty liver if they are viscerally obese, meaning they carry too much fat around the waist. Insulin resistance. Insulin resistance and high insulin levels have been shown to increase liver fat storage in people with type 2 diabetes and metabolic syndrome. A high intake of refined carbs, continuous consuming of refined carbs, develops liver fat storage, especially when high amounts are consumed by overweight or insulin-resistant individuals. Sugary beverage consumption. Sugar-sweetened drinks like fizzy and energy drinks are really high in fructose, which has been shown to drive liver fat accumulation in children and adults. Impaired gut health. Recent research suggests that having an imbalance in gut bacteria, problems with gut barrier function, leaky gut, or other gut health issues may contribute to NAFLD development. How to keep your liver healthy. If you have been diagnosed with fatty liver disease, it is important to keep your liver as healthy as possible and avoid anything that can damage your liver further. Here are some important things that you should do. Alcohol should be kept to a minimum, if not avoided altogether. How much is too much remains arguable, but it's probably best to avoid it completely. Always remember to check that your medications, herbs and supplements are not harmful to the liver. You could also be vaccinated to protect yourself against liver virus hepatitis A and B. Control other health conditions that might also affect your liver, and check with your doctor to see if you might have any other underlying treatable diseases contributing to your fatty liver. Get regular screening tests for liver cancer if you already have cirrhosis. Tips to improve your liver. Losing 10% of your present body weight will be helpful to cut liver fat and lessen the harmful inflammation. If you've tried diet and exercise, but this approach hasn't been enough to help you get to that goal, consider discussing weight loss medications or even weight loss surgery. Adjust your meals to more closely reflect the Mediterranean diet, an approach to eating that features mostly unprocessed or frozen vegetables and fruits, and limits fats to olive oil and nuts. Avoid foods and drinks that are high in fructose, such as artificially sweetened drinks, juices, and desserts. This might go a long way in lowering the levels of liver fat. Better yet, don't drink your calories. Exercising is highly recommended to build up to at least 90 minutes a few times a week, or aim for at least 3 to 5 miles daily. Limiting alcohol to 1 drink daily for women and 2 at most for men is recommended. Ask your doctor what limit is best for you. In addition to protect the liver, ask your doctor about hepatitis A and B vaccinations if you're not already immune.